Invite Dr. Kajal first on stage. Dr. Kajal is in the Indian Administrative Services. She is a director at the Department of Promotion of Industry and Internal Trade at the Ministry of Commerce of the Government of India. She is a clinically trained obstetrician and gynecologist from PGI Chandigarh and has provided administrative and managerial oversight and technical and strategic inputs on public sector-driven programs on reproductive, maternal, newborn child, and adolescent health. Next, we have Hema Swaminathan, who is Professor of Public Policy at the Indian Institute of Management, Bangalore. Her recent research focuses on inequality in income and wealth distributions between men and women, women's labor participation in India, and survey methodology to collect improved data on asset ownership and wealth, decision-making by women, and women's engagement in the labor market. I will also introduce Uma Mahadevan, who will be joining us shortly. Uma Mahadevan is a 1992 batch officer of the Indian Administrative Services of the Karnataka cadre, and she is currently Additional Chief Secretary in the Department of Rural Development and Panchayat Raj at the Government of Karnataka. She has served in multiple capacities at the center and at the state, eminent among them in the Departments of Women and Child Development, Planning, Agriculture, Education, and Health and Family Welfare. This session will be moderated by Urmi Bhattacharya, who is research lead at Inclusion Economics India Center at IFMR Kriya University. She provides technical guidance to research teams to ensure that IEIC is set up to successfully research and conduct effective policy engagement with gender policy counterparts. Prior to this, Urmi was country director at Fortify Health India and research manager at JPA.
Great, thank you. Great presentations and kind of takes us into the weeds of why measuring labor force participation and understanding women's time use is so, or anybody's time use, especially women, is so challenging in kind of the context we work in. I would kind of maybe first like to invite Dr. Kajal to kind of share her reflections for 4 to 5 minutes on, the kind of presentations and generally her take on, supply of, women's work.
Good evening, everyone, and thank you, Urmi. I first of all thank all of you for having me here. It's really been my pleasure, and thank you for the wonderful presentations, and really means a lot. I learned a lot, and this is something I can tell you that as a woman myself, I have started this journey, and it's not that it has been happening in the past. It's still there. We know our patriarchal society and the kind of norms that exist here. So giving you one of the kind of experience which I had very early in my service, from where I started thinking about this particular issue, was that when I started an organization working for them, and it was very new and there was no HR policy in place. And one of the basic premise on which that organization was working, that they were not having anybody on their role. It was a contractual manpower that was hired. So one of the person reached out to me asking for that we are going to the court for seeking a relief, and I was pretty shocked to know that they were going for the relief, and what was that relief sought was that his sister was working as a contractual worker with the organization, and she had her first delivery, and she was not provided the maternity leave. So I inquired, because I thought it's a given norm that every woman in our country, I used to think like that, it's given this benefit. And when I inquired, the reply to me came back as, "Madam, these are contractual workers. They are only hired for 1 year. So out of that 1 year, if that woman goes off for 9 months or for a few months, 6 months, how is she going to contribute to our productivity?" So I was pretty taken aback, and I was like, she's going to have 1 or 2 live births. You're going to give this maternity leave, and this person is going to get her contract renewed every year after year, and she's been here for almost 5 years already with you. So how can you justify this kind of a response, and why she should have to go to court to seek something which I feel is pretty basic, as a fundamental right for a woman, so that the kind of questions we are talking right now, whether this leads to a dip. I personally have encountered these kind of areas where, women was not given the promotion because she took the child care leave, which is available in the system. But then, if you choose to take that leave, you are not considered at par with the other people who have not sought this leave and who have been working. And it's still happening. It's not anything which has been done in the past. So, what is the purpose of having this system in place if it is of no benefit? You can go on leave, you can go for a child care thing, but then when you come back, you are put 2 years behind. So these are the things, which really made me think that why these things are happening around us. And given that I'm a woman and I am on that position today where I can take decisions. So since I was there, I could, I had to convince my senior management to, frame this policy and give at least for the 2 live births this maternity benefit, and we could roll out the policy. I don't know, if I was not there in that leadership position, how things would have worked. And then coming to another area where I have worked and saw it very closely was a brick kiln workers. I was posted in Meerut, which is, if you are aware of the western Uttar Pradesh, there are a lot of brick kiln workers, and this is a very, very informal workforce which is working there. Given some background on that area is that this kind of workforce, usually they have a seasonal migration. They are the informal sector. They are hired by the people who own the brick kilns. They are paid some sort of advance amounts, and then they are brought in. They come with their whole families, and it's kind of a bondage, which is described as a neo bondage. And the system is really not working for them, whether it is their benefits about the kind of industry, because it's nowhere mentioned under the policy. They do not get counted under that industrial wages and all that are made mandatory by our acts. And they are also not considered. For example, the ANMs and ASHAs are not able to reach out to them. The healthcare, the occupational diseases are very high, and their situation is pathetic. So somewhere, these real-time scenarios made me think that what we can do to actually give them that kind of safety, security, and a right to life, which is not just right to life, but a dignified life. I would say the kind of questions that we are talking about is, to some extent, as a policy maker, I believe there is a very big dearth of data, which can really convince and put this forward in a very convincing way that we need to frame a policy around this, and this needs to be taken up on a priority basis. The things have started. I'm not saying that the things are not working, but then these concepts of gender, that lens of gender on the policy making, gender-based budgeting, gender-responsive budgeting. I'm not sure how many people are really aware of these kind of things in the system, but then the talk has started, which is a good thing. But again, there is no formalized or an institutionalized way by which the work that is being done. For example, what Simone was talking about, I really see this something which could be a kind of a rapid analysis. If you really want to have a quick snapshot in some area, then maybe, this kind of scale, which we don't have to go into that gold standard, and a rapid kind of evaluation can be done using this kind of a technique. But these kind of systems need to be institutionalized, and I see a real big gap between the evidence being collected by so many of you and then coming it to us as a policy maker. That kind of, there's no mechanism as of now which I see that can really institutionalize it. And that will really help us both ways, the kind of work that is being done, the kind of rich data which is being generated, there has to be some sort of a mechanism to be put into place. I'll begin from there, but there are a lot, this is a never-ending thing on which I can talk for hours, but then for the time being, I think I'll just lay the context from here and we can take it from there. Thank you.
Thank you. I think that's a very important point, that what are we measuring labor supply and women's workforce participation well, and then how are we measuring them in a way or at a frequency that's or institutionalizing them for policymakers to use. I'll let Professor Swaminathan give her reflections on what was shared on the topic on labor supply, which is more to do with what makes women want to work, nature, what is the nature of work they want to do and are able to do.
Thanks. Is my mic on? Yeah. Thanks, Urmi. Thanks for the opportunity to be here. I really enjoyed both presentations. Rosa, I hope to see yours published very soon. FYI, I'm a co-author on it. And Simone, I was very pleased to see sort of this time use module and the innovation that you've brought to it, because I think, like Kajal said, many of us want to do time use, but the thought of doing it the very elaborate, nationally representative way, I think, is kind of a dampener. So I have been thinking of time use in other contexts, so I'm kind of looking forward to reading your paper very carefully and seeing if it can be adapted. Sort of I want to bring back the point to thinking about supply side issues as well as demand side issues. And we talked a little bit about it in the morning. I think Renana Ben and Ashwini both raised questions of demand side discrimination as well. So I want to sort of categorize it as first generation bias and second generation bias. And this is, I think, borrowing from OBHR and psychology. But first generation bias is really explicit discrimination, wage gaps, inability to sort of participate in the labor market on equal terms, right? And people often think that we are done with first generation bias and they don't exist. And that we are now dealing only with second generation biases, which are the sort of implicit biases that are there in the workplace. And these are actually in some ways much harder. But I think the bad news is that the first generation biases continue to exist. So I think, let me just talk about India, is that we still have Factories Act, which says women cannot work at night. Or we have other acts which prevent women from doing certain kinds of jobs. And these have been handed down to us across for many years. Some of these are colonial hand-downs, which we haven't corrected. And the language, if you read the language of these laws, is actually quite surprising. It says, I think, to protect women, to prevent their exploitation, and to preserve the vigor of the race. Right? So these are the explanations that are given for first-generation bias. And then also you see we don't have laws guaranteeing equality in terms of certain kinds of property access to women. So there is enough discrimination in what I call state-sanctioned discrimination, right? So that's the bad news. But the good news is, if it is state-sanctioned discrimination, you would think it's also easy to get away with it, right? You tell the policymaker, hey, this is just bad. And it ought not to be here. And there's enough evidence around the world which shows that this kind of discrimination is bad for women, it's bad for gender equality, it's bad for your GDP, right? So you tell policymakers, yeah, I like to tell policymakers that it doesn't work, get rid of it. But no, it's very stubborn, right? So I think we still have a lot of work to do where first generation bias is concerned and where discrimination, which is sanctioned by the state, continues to operate in the labor market, right? Then we have second generation biases, which are implicit. Some of these come in the form of even policies. Someone, I can't recall, but someone was talking about our maternity leave policy just being such a regressive policy, right? It says 6 months, but for the private sector, but there's no money to back it up. It's made it really expensive for the private sector to hire women, right? So my incentive, as Manish said, is not to hire women at all. If I have to take them on board, and then a few years down the line, they're going to go on maternity leave, but the government is not going to pay for it, right? So, but the problem is, A, unlike a lot of European countries where the state is actually bankrolling, funding this initiative, or B, what people have talked about is that there is no immaculate conception here, right? So children are born with fathers and mothers, right? So make paternity leave also mandatory, or have family leave and let people figure it out. And this is at a very high corporate India sort of formal sector, right? We are not even talking about the troubles of, and how would you sort of operationalize it at an informal sector. Even at a formal sector level, even paternity leave is 15 days in the government, right? So the government itself is pushing these really regressive norms of saying it's the woman who is the homemaker, who's the caretaker of the child, right? So then of course your second generation bias comes in, because when the woman, or flexible workplace, I have huge problems when only women, mothers of young children, are given flexible workplaces, right? Because then in your mind, you've already written her off at some level. You're saying she's going to be home doing work because she also has to take care of the child. So you are thinking she's busy writing code and doing laundry, right? So make this flexible work option also available to men, right? And see how that plays out, because then you're just penalizing the women who are taking flexible work options because you're saying she's already multitasking, she is not as committed. And it's not true that as generational change happens, a lot of men want to be involved as fathers as well, right? They want to be involved. So you're not giving them the option because the work culture is so masculine and so machoistic that you can't go up to your boss and say, hey, I want leave, right? So there is both, I think, first generation bias and second generation biases in workplace, and I think it's more about changing the norms and the conversation, and I think the state and the formal sector is actually in a very good place to initiate some of these kinds of choices that can happen, right? So I wanted to also talk about measurement, but I can do it after a round of...
Absolutely. I think, just Simone, do you want to kind of respond to any of the topics here? I wanted to kind of bring back the conversation. I mean, this is becoming more of a demand side issues in women's work, labor force participation, which is probably saying something to Ashwini's kind of point earlier in the day. But I wanted to kind of bring back the conversation in terms of, you know, the keynote speak, the talk that Rohini gave, that the problem in India seems to be that women aren't entering, enough number of women are not entering the labor force to begin with. You know, so what, according to you, maybe kind of explains that, or kind of the top few factors, and even if they enter, you know, what are the occupational choices they're making? Are they in line with what they would prefer? Things like that. So any comments?
Well, I think in terms of the barriers...
Can others hear?
Oh, yeah, okay, there we go. I think the previous discussions have covered it well, so I mean, I could sort of repeat what everyone else has already said, but, you know, like, I think my general perspective or thought is that in many ways, I think we have a much better understanding of what the problems and what the constraints are, you know, than what to do about it. Right, and so that to me feels a bit like the place, you know, the place that we are in is we've sort of identified, you know, I think both issues on the supply side, we've identified issues on the demand side. You know, I think kind of trying to identify and operationalize at scale, like policies that address this in a way that really meaningfully moves the needle sort of feels like the next step. And it's not a trivial step in that, you know, sometimes when you try to address a problem, the response that you get to your solution might be, you know, unexpected. And I think, like, in the context of the demand side, for example, you know, we sort of hinted at these unintended consequences. You may have, you know, sort of very good intentions in terms of certain policies making provisions for women, but then this may end up creating incentives for firms not to hire women, right? So how do you kind of thread the needle when we're kind of living in a world in which norms around what a workplace even is and how it functions is really, you know, this is like a system that has been like designed by and for men for like many generations, and so, you know, in many ways it doesn't really fit well with the you know, the rhythms of women's lives. And I guess, you know, maybe the one thing that we talked a little bit about, but I think maybe has not come up quite enough is, you know, kind of efforts to, you know, I think one, you know, kind of give women agency and control over resources, but like Dr. Kajol's comments made me think about, you know, just women in leadership, right? Because you have, I think, as a woman, a very different understanding of the lived experience of what it is to bump up against these constraints. And, you know, if you kind of don't have that seat at the table, or you're not the one who's making policy, you know, we're going to kind of continue to be in this world where you're a little bit trying to fit like a square peg into a round hole in terms of trying to make work structures work well for women. So I'll maybe leave it at that.
Great, thanks. Rosa, your comments, and yeah, I'll just give her a minute to maybe catch her breath.
Okay. Yeah, I think I want to sort of echo what Hema also said, that I think there's an important role for the state to kind of intervene on a big scale in this context. So one is also as sort of a lighthouse effect, right? You have policies in place in public sector hiring, which encourages women's employment, facilitate maternity benefit, which doesn't put the cost on private employers. But I also just want to bring the conversation again back to the supply side issue of the norms, because as much as we say that cultural norms, it's rigid and there's only so much we can do, I do think that the conversation still needs to continue. So I think, for me, I think this particular paper, which I've talked about before, is this paper by Diva Dhar, who did this experiment where they had these kind of fake matrimonial profiles in Shadi.com, which is a matrimonial portal. And so they had these 4 types of profiles of women. So one was women who are employed currently, and they express a desire to continue to work. And then you have women who are employed now, and they say that they will leave work post-marriage. And then you have women whose profiles state that they are not employed and they don't want to continue to be employed after marriage. So, I think these were 3 broad kinds of not resumes, your marriage portfolios that were put up. And what she finds is the portfolios where the women said that they are not employed and they don't want to continue, they don't want to work, received maximum interested men. And who, as you would expect, who gets the minimum callback? It's women who are employed and express a desire to continue working, right? So the norm is that we're educating our kids, yes, the tertiary education gap has narrowed, fantastic, but we're educating our boys for the labor market and we're educating our girls for the marriage market. And there's studies that have shown this, that higher education in good institutions affords women a certain social mobility in terms of marrying into higher social class households. But then there is still the expectation that, hey, you need to stay back, you have your MBA, but you stay back and manage the kitchen, right? So I do think that norms still remain important. The question is, well, if demand comes up, are norms going to loosen? Maybe, but I don't think that these are these things have to happen in concurrence and it's not one or the other.
Great. I'm going to let Uma share your comments.
I can go after everybody else.
Everybody has done it.
Okay. All right.
Maybe the mic.
So, no, I already have a mic. So, any specific question?
Yeah, I think we are kind of talking about that. What are the policy tools, enabling conditions that would help us close the gender gap in employment?
Okay. All right. So, certainly, I would like to mention 2 new initiatives of Karnataka government, the 2 guarantees, which are directly pertaining to empowering women. One is our bus mobility, free bus travel for women across something like 8,000 bus routes across the state, not only in the city, but also, and this is unlimited bus travel for women basis a local address ID. So this is one thing which is very, very important. It has enabled women to get onto buses, women, elderly, women who are young, girls to access higher education, not just college, but even high school. Because if you look at the difference between the number of primary schools and the number of high schools, you see that accessing high school is not just a challenge metaphorically, but even literally, it's a distance away, and therefore free bus travel for girls, for high school girls, is very important, and that's taken off brilliantly. We see groups of women traveling in the buses, stopping the buses, getting onto them. You already know, Shakti. The second is the cash transfer scheme, which again is, again, these may not look like directly related to, this is literally, it's called Griha Lakshmi, right? So it may not look like it's directly related to workforce participation, but these are enablers, and we have to actually look at studying how this will enable women. 24,000 rupees a year 2,000 rupees a month going to women's accounts. What happens to it? How does it enable them? How does it empower them? So that's one thing. Another thing that we are doing, we recognize the importance of childcare. Karnataka in the last few years has recognized the importance of childcare, both for the well-being of young children, safety and well-being of young children, and also for enabling women to go to work, with the comfort that their young children are being looked after. And therefore, in the last 2 years, we took this up in a big way in the Zilla Panchayats and the Taluk level. We have been able to, it's quite a push because it requires, as one of the speakers was saying, it requires not just provision of space and infrastructure and funds, but it also requires a mindset change, because first of all, you find many colleagues saying, why do we need to make space for a creche? And there hasn't been a demand articulated for it yet. And then you're saying that no, but you can do it proactively and you should do it. And so we're happy to say that we now have, over the last 2 years, we've set up 150 creches at Zilla Panchayats, Taluk level, and at some Gram Panchayats. This year we propose to set up 4,000 rural creches at Gram Panchayat level, which will converge with MGNREGA in order to enable rural workers, women and men, to leave their young children in the safety of a good creche where there are trained creche workers looking after. Mobile creche is our training partner. And this is important that this is rural. We often think that urban women need safe childcare, but we did a scoping visit because there were many people who needed to be convinced, and so we actually did a scoping visit in 4 districts, and we looked at the kind of demand there was for safe childcare, because rural women, we think that somebody will always look after the child and so on, but there are elderly women are also working in, not just in MGNREGA, but in other rural employments. So 4,000 creches coming up this year is a big step forward for us, and we hope this will be in addition to the 69,000 and odd Anganwadis that we have in the state, because this will cater not only to Anganwadi age children, 3 to 6, but also to children under 3. And that's an important step forward. That has been a felt need among women, both rural and urban. Similarly, there was an announcement for urban creches as well. In the last 2 years, 150 creches catering to 5,000 children have been set up. In MGNREGA itself, so these are different large schemes, but even within existing programs of the government, for example, in MGNREGA, if we generate this many crore person days in a year, is it possible to look at the percentage of person days that women are getting? So we have incrementally moved from something like 48% of person days going to women to something like 53% across the state. And that is direct money from the labor budget going to women. Additionally, new areas of work, for example, solid waste management in rural areas is a new activity for which new funds have been provided, and initiative of Government of India as well as Karnataka. So what Karnataka did was, in rural areas, we found that women were doing the dirty work. Wherever we went, elderly, poor women were doing the dirty work of segregating mixed waste. But they were doing it because they didn't have any other option, and that was mixed waste. It was filthy work. So we said, instead of doing this, what if we do it as a partnership between the Panchayat and the GP level Federation of the Women's SHGs, where it's actually an MOU which is signed, viability gap funding is given, training is given, and the women take up end-to-end management of the solid waste, including the behavior change communication, the collection of user fees, the collection of the waste, preferably just the dry waste, but in some places where it's unavoidable, even the wet waste, house to house, making the routes. All of this actually involves involves the minutiae of identifying the optimal routes, training them to do the optimal routes, route planning, and even driving the solid waste management vehicles. Funnily enough, nobody objected about training the women for the segregation, because that immediately, even though it was a new kind of work, it was regarded as women's work, because waste has to be handled by women. But when we said even the vehicles, which are auto tippers, small little mini trucks, have to be driven by women, many colleagues, male and female, said, but women won't come forward to do this. When we actually ask the women, the problem is that very often women don't get asked, what is it that you'd like to do? Many of them said, we'd like to do it, we'll come forward to do it. There was a woman in Kolar who said, why a mini truck? I can drive a JCB, and this was on the border, Kolar, Tamil Nadu border. So now, 2 years later, we have 2,300 women in rural Karnataka driving these mini trucks, which is a visible kind of empowerment. There are women who are excited about it. There's a woman in Uttar Kannada who's the first woman from her Kunbi community who learned to drive this, and now she's driving this as this thing. We have 10,000 women, 10,000 plus women who are trained SAG women who have been trained in order to do the segregation as well as the user fee collection and the entire management of, and most importantly, out of 6,000 Gram Panchayats, nearly 5,300 have already signed these MOUs. And we're now, it's uphill. It's not that it's happened overnight. It's uphill, requires a lot of push, a lot of training, a lot of mindset change and so on. But this is the kind of example of how some of our own biases within government prevent us from pushing for large scale change. And these are not nudges. These are direct pushes. You have pushed and you have got, after 2 years, 10,000 women who are doing this, who are engaged in this. These are green jobs. And there's no reason why this can't be, expanded even to urban areas. So these are just some of the examples, but I think a lot more can be done when we study these cases, study these successes, identify what are the challenges and how we can take it forward. Childcare and public transport, big enablers, big pushes, and these have to be, pushed in other places as well.
Yeah, thank you for those comments. I think in the entire day's discussion, giving safe transport and making sure women can access the jobs they want, that has kind of come up quite a lot. We have just 10 more minutes, so I'm just going to open it up to the audience. May I request you to raise your hands, identify yourself and your institution before asking the questions. So we'll take 2, 3 or 4 questions, and then the panelists can choose to respond to whatever part. But I do want to kind of end with, maybe everybody talking 30 seconds on what do you see are kind of the missing pieces of data measurement in understanding what are the gaps, what we should focus our attention on in terms of measurement and things like that. So yes, hands.
Hi.
Okay.
I'm Vijayamba. I'm a postdoctoral research fellow at Azim Premji University. So my first question is to Uma Mahadevan. So about the Shakti scheme in Karnataka. Some of the criticisms that are coming in are till the fleet is increased, like till the number of buses are increased, it will just result in overcrowding to other men and students. So it will not be a success. That is one. And another criticism is that now that the bus fare is free, women are just collectivizing themselves and going off to leisure trips. So I just want to know your comments. These are not, I don't believe in them, but I'm interested to know your comments.
I know.
My second question is to Simon about the use of time use as a policy tool. So in the hybrid method that you mentioned, if we are collecting the activities in these 8 categories, we would be missing out on the detailed activities that time use as a tool has potential to collect. So this is one lost opportunity to know about the gender division of labor. Suppose in crop farming, we will not know whether the woman is harvesting or transplanting, or similarly in other activities. And the dearth of data in the Indian context, I think this is one challenge that will be magnified if we use hybrid method as a tool with time use. So I just want to know your comments on this. Thank you.
Great. Yes, more hands. So we'll take one question here and one at the back, and then maybe the panelists can respond.
Hi, I'm Akhila. I'm a PhD student from Stanford. I think a question to the entire panel, but maybe to Uma as well, because you mentioned some of the physical infrastructure that's available to help women. So some of the things that often came up in my work when I'm talking to women is maybe like a mismatch between when the Anganwadi is open and when women have to be at work. So Anganwadi is being open from 10 to 4, and like sort of like the getting children to the Anganwadi, picking them up, and similar thing applies to government schools as well. And the other one that comes up is water infrastructure in rural areas. Like water is released once in a while, in 2 years, and it's not always certain when it's released. So often some women or often the girl child needs to be at home to see when the water is released. So yeah, just like a few like more like physical infrastructural things that might keep women more at home, and if there's like any sort of schemes or ideas of working on that. Thank you.
Thank you. Great questions. Yes, last.
Yeah, hi, I'm Akash. I'm a PhD student at UC San Diego. So one question I had was if the panel thinks that the way we talk about norms in this context ends up being a little too broad, and if we focus on what types of norms we're really talking about, like even in the morning when people agree that demand side constraints are more binding, but they agree that reallocation of household chores might be a problem. So if we could move that conversation towards the more specific norms of like, if it's safety, is it reallocation of chores, maybe we could have a more productive conversation. And second, I was wondering if from the reallocation perspective, do you also think there's norms against outsourcing of this work where maybe, we're being very ambitious about like immediate reallocation of this care work from men to women, but, use of Anganwadi centers and use of private services for daycare, are there also norms against that? Because, we have this idea that the woman should be the one taking care of the child, and if the panel had thoughts on that. Thank you.
Great. Yeah. So when we say norms, what are we kind of talking about? What should we talk about? What Karnataka is, the bus scheme. So yeah, I'll let the panelists.
Should I answer? There were two direct questions. One was about women traveling for leisure trips, religious trips, and various leisure trips. Why not? The scheme is. So the scheme has just come into place, and there's no specification of what women need to travel for. They can travel for free. So in that sense, it's actually immediately empowering. There's that emotional rush. Groups of women traveling, there will be multiple changes happening, and I think it's too soon to see where this will take us. It can take us to many, many new and potentially very exciting outcomes, and therefore the more women traveling, the better. Exposure, solidarity, lots of things. The second thing is about overcrowding. Again, it's been very early days. On KSRTC state buses outside Bangalore, there has been a reservation of 50% of seats for male passengers as well. So it's not as if women are taking away all the seats. Though, of course, I think it was Ruth Bader Ginsburg who, when asked how many women on the Supreme Court would be enough women, she said, why not 9 or something. It's been too early, and looking at the demand for new buses, all of that will take time, and one will have to assess. But generally, there are good, positive outcomes associated with getting more people onto public transport in any case. Whether it's men, whether it's women, whether it's children, more people going onto public transport means less other kinds of transport. And more people traveling. So that's a generally good thing. Regarding infrastructure, physical infrastructure, Anganwadis in Karnataka already function as partial daycares. They function longer than the stipulated 4 hours. They function for 6.5 hours, nearly 7 hours in many cases. 6.5 hours and half days on Saturday. Generally, these timings are acceptable for most communities. Local adjustments are made in hot districts in North Karnataka during the summer season. Question on water infrastructure in rural areas. Jal Jeevan Mission is now bringing piped water supply with functional household tap connections to every house. This has, despite all the issues, it's a huge scheme, lots of issues, lots of things taking time, expanding, all of that. But when the tap actually reaches people's houses and when the women see, there's still a memory I have of an elderly woman in Gulbarga saying that, she's actually like opening the tap and says, there's the water, it's coming. So it's it's pretty amazing. It's pretty amazing. In 25 years back, when we were very young officers, we saw this happening when electricity reached people's homes. And therefore, this is a very meaningful kind of thing. And that is enabling people who earlier had to spend time collecting water. It's not as if in Karnataka, the public taps were very far away. There were public taps pretty much in every lane. The network of public taps, not household taps, but the public taps. So they didn't have to go very far, but they did have to spend time. And it wasn't as if water was available around the clock. This also may not guarantee water round the clock, but it guarantees assured supplies. People can have tanks, they can fill up water, they can store water. So this is going to be a big enabler for young girls as well as women to use that time for other things. That's what I had to say.
I think some questions were directed to Simone. Do you want to respond?
Oh, sure. So I think the question was, if you do this hybrid method, are you going to kind of miss out on a lot of the nuance and detail of a traditional time use survey? I think that's absolutely correct. That's in the paper. You know, I think you shouldn't interpret the exercise so much as saying we should replace a traditional time use survey with this abbreviated module. You know, I think we think of it very much as a way to do more rather than something different. I would love to see lots of time use data out there, but you know, in settings where you don't have the time, you don't have the budget, you know, I think of this as an alternative, so we can at least be having our eyes on you know, so a few key categories that are important.
Okay, great. We have just 2 more minutes. We are done? Okay, then we'll stop. But I wanted to kind of touch base on, can we have 30 more seconds just to kind of get a sense of what you see are the, you know, kind of the big gaps in measurement or data that need to be, that we need to kind of plug to be able to answer kind of some of these questions well. So if everybody can take maybe 10 seconds or 20 seconds, sorry.
Yeah, it was really a quick wind up. Just to wind up, I'll say that in this our data collection, I would say that we really need to focus more on a dynamic longitudinal studies for those people who are doing it. It will give us a really rich data. I haven't seen, you know, this has been not done here. And number 2, I would suggest that not all programs, I mean, I see all the focus, all the push on the women driven. We need to be taught everything. The major side of the stakeholder is other 50%, and I would like to see more programs, more interventions coming onto that side. And questioning that norm side, I would say that you consider any program or intervention in that socio-ecological model. It cannot be done in silos. You need to see what works in South may not work in North. One of the study that I'm conducting right now, we are doing it. We saw that in Mysore, people were not against having those alcohol use, but in Uttar Pradesh, people were pretty, you know, against it. So there are certain things you really need to understand when you're reallocating these kind of roles, the context in which we are working, and definitely, you know, educating people, not just women. I would say again, we really need to concentrate on that, and defining our categories during data collection. This is really important, bucketing it into the right category. Otherwise, we will not get the right results. So ask the right questions. Thank you.
Great. We are out of time, so I think we'll just kind of end it here. Hopefully the conversation continues. Thank you to the entire panel. Oh, okay.